Okay, hi everyone. My name is Tara Dell. I graduated from Severna Park High School in 2016. I'm a recent graduate of University of Delaware last May in 2020. I am a nurse right now at Anne Arundel Medical Center, so I did nursing school at University of Delaware. And I'm just here to talk a little bit about my journey and my process through nursing and college and everything. So I didn't know I wanted to be a nurse. Some people know from the time they were 5 or whatever that they wanted to do nursing or they wanted to do their certain career, but I had no idea. And then sophomore, junior year, when I started to think about college and my career and what I wanted to do, I just started to talk to some mentors I had and friends and family about things I was good at and things I was interested in and kind of what that would look like as a career. So I knew that I really enjoyed helping people and caring for other people, just doing a lot of different volunteer opportunities and mission trips in high school and things like that. And then really enjoyed all my math and science classes in high school. So decided, hey, nursing might be a good fit for me. So just started looking into different nursing programs at different colleges. And if you are interested in nursing, one thing that is definitely important to look into is um, certain colleges have either, it's called direct admission or indirect admission. So direct admission would mean that you were applying to the college and you were also applying to the nursing program. So for example, when I applied to Delaware, I applied to the nursing program, so I was in right from the get-go freshman year. Other colleges, indirect admission, so I would maybe apply to the nursing program, but it was kind of a pre-nursing, and then so I would get into the school, and then sophomore, junior year, you would apply to the nursing program. So just different, pros and cons to both. I kind of knew I wanted to do nursing. I was pretty firm in that, so I didn't want the um, I guess, stress or uncertainty if I was going to get in, that sophomore, junior year. But some people it gives you a little like room to figure out maybe you want to change your major or things like that. So pros and cons to both. But I ended up deciding on Delaware, just close enough to home, but not too close, and had the major I wanted and got into the nursing school and just loved the campus and all of that. So did my 4 years, loved it, had a great time, highly recommend University of Delaware. I had a great experience there. And then ended up deciding to move back home to Severna Park and got a job at Anne Arundel Medical Center in Annapolis, as I said. And so I took my boards exam last summer. So you have, for nursing, you have a boards exam. It's called the NCLEX. You decide to go into nursing, you'll start hearing about that very early on. So you have a boards exam that you have to pass generally the summer after you graduate. So I graduated in May, and then I took my boards at the end of July, and then I started my job at the hospital in early August. So I generally started applying for jobs in the spring, but I had some friends that didn't apply to jobs until the later spring or summer. So it really just depends. And a lot of hospitals now are doing, it's called a nurse residency program. So you apply to the residency program at a hospital, and then you kind of have choices of what floor you would like to be on, different specialties and things like that. And then most hospitals, at least this is at Anne Arundel, you have a 1-year program, and you get mentored by older nurses. You have classes once a month, just educating you on different things within the field and different things about being an adult. We've had classes from, personal finance to protecting yourself in the workplace and just all different things. So it's been really helpful, and that's a year. So I'll graduate from that program in July. And we also do an evidence-based research project with other nurses on our floor, which has been a good experience. So I took my boards and then I started my job in August. Decided to move back home, so just living at home with my parents right now, working at the hospital. So my day-to-day, my schedule is I do kind of abnormal to a normal work week. I do 3 12-hour shifts in a week. So my week could look anything like working Monday, Tuesday, Saturday to Tuesday, Thursday, Friday, anything kind of can change every week, and you are required to work depending on where you work. You'll have a weekend requirement. So I'm required to work 3 weekend shifts a month. Other people have to work every other weekend. It just kind of depends on what your hospital or place of work has in place for that. So when I started my floor, I'm on the general surgical unit. So we get a lot of post-operative patients, people coming out of surgery, and then overflow of different just medical patients and people coming through the emergency room. So really a lot of everything. I've definitely learned a lot. Um, but my nursing program, when I started, I had 12 weeks of orientation. So that means 12 weeks of I was following around another nurse or, shadowing with another nurse. And they teach you how to just be a nurse. And, you learn all this stuff in school, and they kind of guide you along and how to give your medications and how to assess patients properly, and all the stuff that you already knew and learned from school, but kind of putting it into practice in the real world. So that was definitely huge for me. I like to take my time. I like to ask a lot of questions, so it was really helpful, for this first 12 weeks having someone there with me. And the first few days you kind of do, you're more shadowing, and then as you go along, you kind of start to do more and more on your own. So after those 12 weeks are over, you're off on your own. You're not following another nurse, but hopefully, this has been my experience. Hopefully, any floor you work on would um, have a lot of extra help, and there's always someone I can call to ask for help, which has been really helpful. And I just feel very supported, and yeah, it's been a great experience. And now I'm, I guess, 8 or 9 months out. I can't believe it. And I've really enjoyed it. Just learned a lot, and yeah, I highly recommend. Um, Healthcare field, definitely. COVID has been a little crazy, but definitely anything in the healthcare industry is in really high demand right now. So it's exciting to see all these different changes and just kind of be. And sometimes it is hard to be in the thick of it, with COVID and all that. But it's exciting to be at the hospital and be able to have conversations with other healthcare professionals about everything that's going on. So, yeah, I think that's all I have.